So with the new year, it's the perfect time to talk about why men need to commit to better health. And we're joined by Dr. Alan Weinberg of Southland Urology in Fullerton and Yorba Linda. Thank you so much for joining us. Appreciate that.
Thank you for inviting me.
Let's see. What can you tell the people at home why it's so important for men to get to the doctor? Because we know they're very resistant to doing that.
Well, there's health maintenance, there's health improvement, and thirdly, identifying problems before they become complicated or severe.
Well, let's talk about some of the certain problems. You say the screenings are pretty easy, but can you tell us the 4 screenings that men really should get?
There's a simple blood test called PSA, stands for prostate-specific antigen, and identifies a protein in the blood that, when elevated, can indicate prostate cancer, prostate inflammation, or prostate enlargement.
What age do they start getting that?
Usually age 50, unless you have a family history of prostate cancer or black, then usually age 40.
Okay, what other tests you got?
The other test would be colonoscopy, identify polyps in the lower GI tract, which, if untreated, turn into colon cancer. So one can prevent colon cancer by colonoscopy. Then there's the lipid panel to measure cholesterol, good and bad cholesterol, which can be predictive of future heart disease. So you can make a lifestyle change to improve cholesterol. And finally, there's a simple test can be taken at home called the IPSS, or International Prostate Symptom Score. Measures a few questions where you're scored from 1 to 5 to see whether you have prostate enlargement issues that affect over a quarter of men in their 50s.
Wow. Okay. Well, let's talk about it. At what age should men start getting screened, and how often should they continue to be getting screened?
The screening begins about age 50, again, unless there's a family history, or African Americans age 40, until usually age 70. And it should be yearly, but this simple test can be taken at home to identify if one has a problem with, weak flow, hesitancy, stopping and starting, dribbling, getting up at night. And in the past, there were complicated, sometimes risky surgeries that were inpatient surgeries with risks of erectile dysfunction and incontinence. But now there are exciting procedures with excellent follow-up that can be done in the office in under an hour. That obviate all the need for major surgery with outstanding results. And
is that the UroLift you're talking about?
That's the UroLift.
And what is that?
UroLift is a technique where, instead of what we did in the past for 100 years, is we removed tissue. We would go in and scrape it or ream it, laser, heat, cook, and now we simply move it out of the way, just as if the curtains are blocking the window. Open the curtains with some curtain tiebacks, and the urination, the flow returns to normal, very, very easy, minimal side effects, and very quick results.
Wow, that's interesting.
Yeah, we both look at Danny.
Yeah.
Are you getting screened, Danny?
Yep, I'm the one. Just a quick note, the thing to really stress, and to, again, we talk about boyfriends, men, get your guy, go see a doctor. I mean, so many men just be hesitant about doing it. I'm not one of them, because I had early tests all the time. I've had colon cancer a few times, and the screenings kind of caught it a few of those times too. And so getting in and doing those tests is, as the doctor says, really vital.
And the website urolift.com has a lot of information about this, has this simple IPSS test, and one can see if he has a problem.
Yeah, and it's simple. You can find that online test we talked about right there at urolift.com, right there, urolift.com. And of course, you want to learn more about the good doctor, Dr. Weinberg here, just go to southlandurology.com, get all the info there. Good doctor, thank you very much for the good info, of course.
And he's not scary, so
Yeah, there you go.
Yeah, he's a nice guy.
Yeah, all good.
You have to drag him in there. You can sit in the office while they go inside.
It's all safe.
Thank you very much.
You're welcome. Thank you.
All right.